Did you ever stop to wonder why some potential cures never see the light of day? Imagine a world where alternative solutions to our health problems are silenced and suppressed. This is the controversial theory of the medical mafia, a concept that implies a sinister side to our healthcare system. Could there be a clandestine force at work, systematically stifling alternative cures for the sake of pharmaceutical profits? It's a provocative question that demands our attention. Let's dive deep into this controversial theory and uncover the truth. Consider the case of Royal Rife, a scientist who claimed to have a machine that could destroy harmful microbes in the body. In the early 20th century, Rife developed what he called a frequency instrument. This machine, he claimed, could eliminate disease-causing microbes by bombarding them with frequencies that caused them to disintegrate. For a time, Rife's work was lauded by many in the scientific community. But rather abruptly, his research was discredited. His machines were destroyed, and Rife himself was ostracized from the scientific community. Many believe this was not due to a lack of scientific validity, but rather a deliberate attempt by the established medical industry to suppress a potential threat to their profitability. Now let's move forward a few decades to the case of Renee Case, a Canadian nurse who developed an herbal remedy known as Essiac. Case claimed that Essiac could effectively treat cancer, and she had a multitude of patient testimonials to back up her assertion. Yet, despite the growing body of anecdotal evidence, the medical community was quick to dismiss Essiac as a hoax. Casey faced legal battles, professional ridicule, and her remedy was never officially recognized or approved. Again, critics suggest that this was not a reflection on the effectiveness of Essiac, but rather a systematic effort to suppress alternative treatments that could undermine the pharmaceutical industry's dominance. These two instances, separated by time and geography, share striking similarities. Both Rife and Casey claim to have developed non-traditional treatments that threatened to disrupt the status quo of the medical industry. Both faced significant and seemingly disproportionate backlash. Both were ultimately silenced, their treatments dismissed and forgotten by mainstream medicine. These are just two examples of many that raise questions about the motives of the medical industry. So, what can we do about this alleged suppression of alternative cures? It starts with us. We must cultivate a mindset of curiosity and skepticism. Don't be afraid to ask questions, to seek out alternative viewpoints, to challenge the norm. Let's delve deeper into the world of medicine, not just accepting what's presented to us, but actively seeking out more. It's about fostering a culture of critical thinking and open-mindedness. Don't just accept what you're told. Challenge the status quo and seek the truth about your health.